Welcome to motherhood. You and your new baby are getting to know each other, and so is your body with its new job of making milk. A few days after giving birth, you might notice your breasts feel very different. They can become surprisingly full, heavy, and even a little uncomfortable. This is often due to something called breast engorgement. It's a completely normal and temporary part of the early postpartum experience. Think of it as your body's amazing milk factory kicking into high gear for the very first time. Your breasts aren't just filling up with milk. There's also increased blood flow and extra fluids in the breast tissue, all working together to get production started. So, why does this happen? Around 2 to 5 days after you deliver your baby, your initial milk, called colostrum, begins to transition to mature milk. This transition causes a sudden surge in milk volume, and your breasts can fill up faster than your newborn can empty them. This is especially common for first-time moms, but it can happen to any mother. It's a sign that your body is doing exactly what it's supposed to do, preparing a nutritious food supply for your little one. While it can be a bit intense, this feeling of extreme fullness usually subsides within a day or two as your body and baby get into a feeding rhythm. It's helpful to remember that engorgement is a temporary phase. Your body is smart, but it's still learning how much milk your baby needs. In these early days, it sometimes overproduces until it gets the right signals from your baby's nursing patterns. This supply and demand system takes a little while to balance out. The fullness you feel is the result of this initial overenthusiasm from your milk-making cells. The key is to help your body regulate this supply by encouraging your baby to feed often. This process helps establish a good milk supply for the weeks and months to come, ensuring your baby gets all the nourishment they need to grow strong and healthy. Don't be alarmed if this fullness happens suddenly. Many new moms go to bed with soft breasts and wake up feeling like they're carrying 2 bowling balls on their chest. The sensation can be quite startling, but rest assured, you are not alone in this experience. Nearly every breastfeeding mother goes through some degree of engorgement. It can also happen later on if you miss a feeding, or if your baby suddenly starts sleeping for longer stretches at night. Understanding that this is a natural biological process is the first step toward managing it with confidence and without unnecessary worry. Knowing what to look for can help you identify engorgement early and take steps to feel better sooner. The most common sign is that your breasts will feel very hard and firm to the touch, almost like a melon. They may also feel warm and look shiny or slightly reddened. You might notice that your breasts feel incredibly heavy and tender, and even the simple act of putting on a bra or shirt can cause discomfort. Some women also experience a throbbing or aching sensation as the pressure builds up inside the breast tissue. This is all caused by the combination of milk, blood, and fluids crowding the area. Beyond the feeling of fullness, you might notice other physical changes. The swelling can sometimes extend all the way up into your armpits, where you may feel tender lumps. These are swollen lymph nodes or accessory breast tissue, which are also reacting to the hormonal signals to produce milk. One of the most challenging symptoms of engorgement is how it can affect your nipple. The skin of the areola, the darker circle around your nipple, can become so stretched and tight that it causes your nipple to flatten out. This can make it very difficult for your baby to get a good, deep latch, which is essential for effective milk removal. This difficulty with latching can create a frustrating cycle. If your baby can't latch properly, they can't effectively drain the milk from your breast. When milk isn't removed, the pressure continues to build, making the engorgement worse. This can be stressful for both you and your hungry baby. You might also notice that your milk flow is slower than usual because the internal swelling is compressing the milk ducts. In some cases, the intense physiological process of milk coming in can even cause a low-grade fever, sometimes called milk fever. This is your body's inflammatory response to the sudden changes. It is so important to manage these symptoms right away. If engorgement is not addressed, the backed-up milk can lead to more serious issues like plugged milk ducts. A plugged duct feels like a small, hard, and tender lump inside the breast that doesn't soften after feeding. If a plugged duct isn't cleared, it can sometimes lead to a breast infection called mastitis, which comes with flu-like symptoms, a high fever, and significant pain. By recognizing the early signs of engorgement and taking action, you can prevent these complications and keep your breastfeeding journey on a much smoother, more comfortable path. The best and most effective way to relieve engorgement is to remove milk from your breasts frequently. The goal is to keep the milk flowing. The most efficient way to do this is by feeding your baby often. Aim to nurse at least every 1 to 3 hours, around the clock, including overnight. Don't wait for your breasts to feel overly full to offer a feed. Watch for your baby's early hunger cues, like rooting, smacking their lips, or bringing their hands to their mouth. Letting your baby nurse, whenever they show signs of hunger, helps regulate your milk supply and prevents your breasts from becoming uncomfortably full. Make sure your baby is nursing for a good amount of time, at least 15 to 20 minutes to drain the breast well. If your breasts are so firm that your baby is struggling to latch, you can try a technique called reverse pressure softening. Gently press with your fingertips on the areola around the base of your nipple for about a minute. This helps move some of the swelling away from the nipple, making it softer and easier for your baby to grasp. You can also hand express or use a breast pump for just a minute or two before the feeding. The goal isn't to empty the breast, but just to release a little bit of milk to soften the area enough for your baby to latch on comfortably and effectively. This small step can make a huge difference. Temperature therapy can also provide significant relief. Before you start a feeding, applying warmth to your breasts can help encourage your milk to flow. You can take a warm shower or apply warm, moist compresses to your breasts for a few minutes. This helps to relax the tissues and open up the milk ducts. While you are feeding, you can gently massage your breast, stroking from the outer areas toward the nipple. This helps move the milk forward and can help empty any areas that feel particularly hard. Changing breastfeeding positions, like switching from the cradle hold to the football hold, can also help drain different parts of the breast more thoroughly. After you finish a feeding, it's time to switch to cold, to reduce swelling and soothe the pain. Apply cold packs, a bag of frozen peas wrapped in a towel, or even chilled cabbage leaves tucked inside your bra. The cold helps to constrict the blood vessels, which reduces blood flow and swelling in the breast tissue, providing much-needed comfort. Apply these cold compresses for about 15 to 20 minutes at a time. Using this combination of frequent feeding, pre-feed softening, gentle massage, and the strategic use of warm and cold temperatures will help you manage engorgement and get back to feeling more comfortable. While you're working to relieve engorgement, there are a few things you should try to avoid. It might be tempting to give your baby a bottle of formula or water between feedings, especially if you're sore and tired. However, this can interfere with your body's supply and demand system. Every time your baby takes a bottle instead of nursing at the breast, your body misses the signal to make milk. This can actually prolong the engorgement problem because your breasts aren't being drained as often as they need to be. Sticking to breastfeeding exclusively in these early weeks is the best way to help your supply adjust to your baby's exact needs. It's also important to be gentle with your breasts. While massage is helpful, aggressive or deep massage can cause bruising and damage the delicate breast tissue, which could make things worse. Think of it as gently stroking or combing the breast, not kneading it. Also, be careful with how you use your breast pump. Pumping for long sessions to try and completely empty the breast can signal your body to make even more milk, leading to a cycle of oversupply and more engorgement. If you need to pump for relief, only pump for a few minutes until you feel more comfortable, rather than pumping until the breast is totally soft. Most cases of engorgement will get much better within 24 to 48 hours with these home care strategies. However, you should not hesitate to reach out for professional help if you are not feeling any relief or if your symptoms are getting worse. Be sure to call your doctor, midwife, or a lactation consultant if you develop a high fever, over 100.4 degrees Fahrenheit or 38 degrees Celsius, if you feel flu-like symptoms such as chills and body aches, or if you see red streaks on your breast. These can be signs of a breast infection or mastitis, which may require antibiotics. You should also seek help if you have a hard lump that doesn't soften or go away after a day or two of frequent feeding and massage. Please remember to be kind to yourself during this time. The first few weeks with a new baby are a huge adjustment, both physically and emotionally. Dealing with breast engorgement can feel overwhelming, but you are not failing. It is a sign that your body is working hard to nourish your baby. Don't be afraid to ask for help, whether it's from a healthcare professional, a lactation support group, or your partner and family. With a little bit of know-how and a lot of support, you will get through this temporary challenge and settle into a comfortable and rewarding breastfeeding relationship with your baby.